Hey everyone, it's Loren from the Dermal Clinic and welcome back to the channel. So my name's Loren, I'm a registered nurse, dermal therapist, dermatoscope user, and I live in Hervey Bay, Queensland, and there's a lot of people and programs out there that will tell you all about the different products and everything that we can use on our skin, but what about all the different technologies that are out there that are available that are really going to give you some good results? So in our last couple of videos, we talked about laser genesis, which is a gentle, warm, slower laser. And then we went and did a dive into erbium laser, in particular the Cutera Pearl treatments, which completely resurface the top layer of your skin in one clean sweep. But today we're tackling a term you have probably heard a million times, and if you ever looked up acne scarring or deep wrinkles, fractional laser, not Fraxel, fractional laser would have come up in some sort of treatment in regards to these more deeper crevices and issues that occur on the skin, such as your scarring and your deep wrinkles. So what on earth does fractional actually mean? Why would we want to fractionize a laser beam? And how does drilling thousands of microscopic holes deep into the face actually make your skin look flawless? Or how does this actually improve the quality and texture of your skin? And I'm going to try and explain the physics which we use, along with some fun analogies. As we know, I've used a mattress and a trampoline before to try and explain how all these treatments affect our skin and show you why we love a fractional treatment and why we love the fractional technology. So I'm here to help you understand exactly who this treatment is for. So as usual, grab a coffee if you're like me, your water, whatever you need to get through this with me so we can learn about these treatments together, and let's get started. All right, let's start with the big question. What is fractional laser? So traditional laser resurfacing is what we all call full field. It treats 100% of the skin's surface. It's like a giant wave washing away the old epidermis. It works really well, but the healing can be very intense. As we talked, there are risks and implications with any sort of full field and ablative laser, especially when we're taking off the full epidermis, and there can be weeping, swelling, which we discussed in our previous videos. So fractional, which is a fractional laser, is a completely different treatment to that. To understand how it works, we need to actually look in a little bit deeper. So imagine my laser is a big bucket of water. If I pour the water over your face, you get completely soaked. But if I pour it through a colander, the water is divided into thousands of tiny separate streams of water, leaving dry spaces in between the holes. So this is exactly what a fractional laser does. Instead of treating the entire skin surface, we do a grid-like pattern, and the beams are separated, which leaves healthy tissue in between each beam. So this laser grid divides the laser beams into thousands of microscopic pixel-sized columns of energy, which we call microscopic thermal zones. So this is your MTZs. Again, medical field love all these sort of shortenings of words, and not many times do we actually know what it means, but it is the microscopic thermal zones. So if you want an even better analogy, because that one wasn't my best, let's be honest, a bucket and a colander and water, that's probably not the best one. I feel I can do better. I only know this because husband's obsessed with the lawn at the moment. So if you want an even better analogy, think of a lawn aerator. You know those machines or those shoes that you put on with the spikes and you walk around and you aerate your lawn, and they go all over the dry, compacted grass, and it can poke those deep, tiny holes into those areas that aren't exactly the nice, lush grass that we want. So they don't dig up the entire lawn. They just poke those thousands of deep, tiny channels so that the soil can breathe. It can absorb the nutrients a lot better, and it can grow back thicker and greener. So that's I think that's a better analogy than the bucket, but that's what we're trying to essentially do. So a fractional laser is literally a high-tech lawn aerator for your face, okay? It drills microscopic channels from a controlled thermal injury deeper to the skin, leaving or skipping areas completely untouched, and the healthy skin in between those holes, so that your skin can regenerate a lot quicker because you have that healthy tissue there that can already build back up again really easily. So now let's look at the specific technology that I use here in clinic, which again is the Cutera device. And again, this is not sponsored. God, I wish it was, because these machines are an investment. But again, I did my research, and to be honest, the team at Cutera were amazing, and they really do care about continued education and also what we can do with these devices. Now, the reason I did go with the Pearl Fractional head as well, because each head does cost an investment, is because I wanted to be very versatile in what we can treat here, and I don't want to have to limit the treatment options that we can provide for our clients. So just like our full field Pearl or our ablative erbium laser, the Pearl Fractional uses a completely unique erbium laser as well, the 2090 nanometer YSGG wavelength. So again, it's the wavelength. If you're into lasers, that will mean something to you. If you're not, all you need to know is it's that Goldilocks zone again, where we're creating the thermal injuries that we need to at a specific nanometer wavelength, okay? And in this case, it's the 2090, so 2790 nanometer YSGG. So this wavelength is a clinical powerhouse because it gives me absolute computerized guided control over two things, okay? So the ablation and the coagulation. All right, so ablation means that we are physically vaporizing a tiny column of damaged tissue. Coagulation means we are delivering a controlled zone of heat around the edges of the columns to stop bleeding and instantly wakes up your skin's repair system. So it's starting that wound cascade again. We've created an injury. The body says, okay, we need to heal ourselves. We need to fix that. We need to start producing all the collagen. We need to send the red blood cells. It does all those things. All right. During a fractional treatment, we use 300 micron spot size. Okay. So to put that into perspective for you, 300 microns is roughly the width of 3 human hairs. So that's the size of the columns that are piercing into the skin. Another way to think of it is like microneedling, but in laser form, okay? So the laser fires a pulse at 600 microseconds and blasts these microscopic laser columns deep down into the dermis. So again, going back to my amazing mattress analogy, I just love beds so much that I use a mattress for 90% of my analogies. The mattress layer of the skin. So we can customize the energy from 60 all the way up to 320 millijoules per micron spot, allowing us to safely drill these columns over a full millimeter deep into the skin, which is pretty incredible. And again, if that all meant nothing to you, let me try and explain it into what the fractional laser actually does. So while we are going incredibly deep to target severe damage, we are only targeting about 10 to 15% of the skin's actual surface area per pass, all right? The other 85 to 90% of your skin is completely untouched. And it's doing this because we can keep that tissue intact while these tiny laser beams go down in, and because it is basically coagulating that straight away, it's not burning or causing any other damage to the tissue around it. So what this means is that it leads to the ultimate physiological secret of the fractional laser, okay? The healthy neighbor rule. So the healthy neighbor rule, it sounds, just like neighbors or home and away. But when we drill down to the MTZ, the skin cells inside that column are vaporized, but because they are surrounded by a massive reservoir of healthy, uninjured skin cells, those healthy neighbors instantly wake up, share the nutrients, and rush in to repair the tiny zapped zone. All right. So instead of waiting weeks for a completely raw face to heal, your skin completely closes up and it re-epithelializes. So What that means is it's growing a brand new surface day by day, okay, for about 4 days. It is deep tissue remodeling with extraordinarily fast healing because we've kept that other tissue intact, which means the downtime can be decreased and you can still go about your day, usually after 3 to 5 days. But because we are drilling a millimeter deep down into the dermis and triggering a massive biological remodeling cascade and response, who is the ideal candidate? This treatment is a gold standard. And again, I talk about gold standards because I like to provide the best that is very researched. Not saying that there's not anyone else out there doing it differently that's getting better results. This is what I practice. This is what I've researched. And this is what it was basically designed for. Okay, so this is why I got this one into my clinic, because what it does do very well is it is fantastic for stubborn acne scars, especially those deep ice pick or boxcar scars. The laser physically breaks down the rigid scar tissue and stimulates fresh collagen and plumps those deep valleys up, really softening the appearance of those stubborn scars, okay, that are quite deep and can look like texture on the skin. Another reason we did get this in here at clinic as well is because it's very good at treating the traumatic and surgical scars. So I can dramatically remodel raised or depressed scars to blend them back into the surrounding skin. So we're talking about, you have this done on your body, like I said. What about your C-section scarring? What about your breast augmentations? What about your mastectomies? You can have this done on your knees, for knee surgery, hips. It's a fantastic technology that can really assist with your surgical scarring, but also trauma scars. I will be doing a little video on it later on down the track because, as we know, my husband is accident prone, and we're almost to the point where we can start doing this sort of laser treatment on his finger, which he did gloved at work. And again, with TR Pro, it is healed amazingly fast for someone who is not compliant at all. But the skin is very tight, and this is a traumatic. So this was an accident wound that has occurred, and he's definitely going to need some assistance to take out that scar tissue, give him some more flexibility back in his finger, and we'll show you that as we go along as well, because he's going to be an amazing case study because he is so non-compliant. So we'll see how his goes, and this will be like the bare basics that we can achieve because he is so non-compliant. Is he the most ideal client? Absolutely not. Do I have to live with him and I have to deal with the consequences if anything goes wrong? Yes, I do. So that is my own doing. Another thing that we use this for, sorry to digress, you know that's what I do, deep mouth and eye lines, okay? So those stubborn smoker's lines around the lips, those deep crow's feet, that normal facials and that can't really touch, this is going to help lift. I'm not saying this is a be all and end all. This works beautifully with our injector nurses, okay? So if you come in, we can see me, we can soften them. And then if you want even more lift, that's when you can start looking at your fillers as well. We work very nicely together. I'm not talented enough to do injectables. It's something that I'm not passionate about, whereas I'm very passionate about using our body's own incredible healing mechanisms to do so much, really, as long as we're doing it in a controlled manner like we do with lasers. But yes, there's not saying that we're the be all and end all, especially with mouth lines and your eye lines. We can soften it. We can get it to a point where you don't need as much filler or you don't need as much intervention from other avenues, okay? And then advanced photo aging. So we're talking that leathery, sun-damaged skin, the deep wrinkles from years of UV exposure. This is where it comes into play as well. Because the skin most of the time is usually quite damaged, especially because it's been compromised with a lot of UV exposure, we're able to do a very productive deep treatment while also keeping the tissue intact. Therefore, it's going to help with the healing time and it's going to thicken the skin. We always want thick skin, okay? It's going to help with that healing process as well after all those years of damage. So now quick clinical note, because a fractional treatment is an ablative treatment. This is disturbing the epidermis. We have to be extremely careful when it comes to our different skin types. As you know, we always do talk about who this is best suited for, okay? If you do have a lot of melanin and you're rich in pigment, this is not ideal for medium to darker skin tones. Now let's have the mandatory serious nurse talk. So again, under our strict Australian upper guidelines, we are legally required to be completely transparent on all medical realities of these treatments, okay? The fractional treatment is, again, it's invasive. It is performed with a class 4 medical laser. It is not a relaxing beauty facial. We do not do them here. There are people out there who are far better at it and are way more qualified to do those beautiful facials. That is not me, okay? Because it is an ablative laser, it must be treated with clinical respect, as always with any of these laser devices. Because we are creating an actual micro wound in the skin, there is a real clinical risk involved, okay? So the potential adverse events can include prolonged redness, your erythema, swelling, you can get pinpoint bleeding, there is a temporary crusting or bronzing of the skin, okay? So it looks like brass on your skin, okay? It's not as bad as your ablative treatments because there is that tissue still intact in the skin area, but it can still have that bronzing effect on the skin. There's also the risk of skin pigmentation, such as hyperpigmentation, which is the increasing of pigment, and hypopigmentation, which is the loss of pigment in the skin that we've treated. And in rare cases, and we're always very honest here, there is a chance of having blistering, there's risk of burns, and there is the risk of infection because we are creating a wound. So that is why you must listen to your practitioner about the aftercare. It is extremely important. The aftercare is more important than anything that we will do here in clinic, okay? So this is why we never skip steps. I never do a lunchtime sale, and anyone who is offering a sale, unless it's for training purposes or for filming purposes, probably not a great place to start, okay? I understand everyone has financial restraints, but when it comes to these sort of procedures and treatments, it's something you have to invest in, you have to be comfortable with, okay? So the clinical consultation is your non-negotiable, as you are well aware. I will always say you need a consultation. Before we even book a treatment, we sit down, we have the face-to-face, okay? We review your full medical history, we discuss your motivations, we discuss like what's your goal, what is your endpoint, what would you be happy with, are they realistic? We have these discussions because we want you to have realistic expectations of what a treatment can do, because there is no miracle treatment, okay, that can be performed non-surgically. We also require your skin to be prepped, okay? So we always do prepping of the skin, but also this is not a treatment that you can just go, yes, I'm gonna come in and have that tomorrow. There is still downtime, it's 3 to 5 days at the worst, but I also have to order in numbing, which is scripted specifically to you, and I have to make sure that we have all the appropriate aftercare that is brought in. So with our treatments, you do get all your aftercare products provided to you because I want you to have the good results and I want to build you up for success. So it's not something that we can just book in and go for. It usually takes a week to get everything in line in order so that you can have a successful treatment. So we always prep and ensure that everything is ready to go and we've built you up for success and there's not going to be any hiccups along the way. So if you go ahead with, say, a fractional treatment, what can you exactly expect right after it? Immediately post-treatment, your skin feels very warm, like an intense sunburn, and you will have tiny pinhole spots and a grid pattern all across your face, all the areas that we treat. Because the laser has drilled open these microscopic channels, so your skin is temporarily wide open and highly vulnerable to transepidermal water loss. This is where your aftercare is 50% of your actual clinical results. And with this treatment now, you will be getting your TR Pro Plus to go home as part of your aftercare. You must protect those open channels, okay, with hypoallergenic and an occlusive barrier support, okay, because we do not want you to have an infection. So immediately after the procedure here in the Dermal Clinic, we will reach for, say, is Clinical Shield Recovery Balm to smooth and protect, to speed up your recovery, or you would be having the TR Pro Plus applied as well, just depending on what your skin needs at the time and the health of it and what's going to be the best option for you. And then we usually send you home with our Is Clinical post-procedure pack, or we also have our Mesothetics procedure pack. Again, just depending on your skin, what we're trying to achieve, and we're hoping that we can actually get you the best results possible. Do you need to continue using these products after the procedure? Absolutely not. But again, I have trust issues, and I just want to make sure that you have the products that I want you to use while you're in the healing process and while your skin's the most vulnerable, so we can get them to actually have the best results possible for you. All right. Once you've used the aftercare appropriately, and that's important to listen to whatever your practitioner prescribes you as your aftercare. So whether we're remodeling deep acne scars or revising years of sun damage and UV, the fractional laser technology is really quite amazing at what it does and how it does it. The laser technology allows us to go deep. It works hard, and still you have back to normal routine in a few days, so 3 to 5 days. So what I do recommend is a Thursday night treatment, having a Friday off, and then you're back to normal on the Monday, or we do it on a Friday, have the weekend off on a Monday. Again, it's completely up to you, but I do genuinely recommend at least 3 days just to ensure that we're not having any infection or anything like that, okay? But anyway, that is the fractional laser. I would love to hear from you. If you have tried fractional laser, or do you have stubborn acne scars? Have you ever tried a treatment like this before? If you have any questions about how I've explained this, please let me know. I'm more than happy to answer questions or go into something a lot deeper for you. I'm just here to try and assist you as best as possible to understand all these treatments and these words and terminologies that gets thrown around in a clinical environment. But anyway, thank you so much for listening. I know it's a lot to get through. Don't forget your SPF, and I will see you on the next episode.